processes involved in ovarian cancer staging. Cancer of the reproductive system is very common among women today. Needless to say, it results in a lot of abnormalities and sometimes can lead to death.
This is why it is recommended that cancerous growth should be treated immediately it is discovered. Ovarian cancer is the most common of all the reproductive system cancers among women. It simply means cancerous growth in the ovaries of women. According to research, the percentage probability of developing this form of cancerous growth throughout the lifetime of any woman is about 1 in 4. This figure shows how common this form of cancerous growth is among women. However, the diagnosis and treatment of this growth is very difficult for women whose age is greater than 63. The major difficulty in handling this form of malignancy is due to the fact that it is difficult to perceive the symptoms of this ailment. There are symptoms which signify the presence of this malignant growth. However, they are also generally used for other complications among women. Ovarian cancer symptoms appear pronounced only at the critical stages of the disease. This obviously calls for carefulness in the study of chemotherapy among women. This would help them to dictate the presence of this malignant growth in their body in case the physician is absent. The various stages involved in this malignancy would be elaborated in order to educate you on the risks and preventive measures involved in this cancerous growth. Stages involved in ovarian cancer. Ovarian cancer staging is based on a number of factors. This classification of diseases was done by the International Federation of Gynecological Oncologists. Therefore it is called the FIGO system, from the acronym of the Federation. The factors taken into consideration by FIGO in the classification of ovarian cancer are its location, size and extent. The Federation staged this ailment with the Roman numerals, from A to F. Substages include letters of the alphabets, from A to C. On studying this staging procedures, you will realize that the main division, denoted by Roman numerals, signifies the location of the tumor in the woman's body, whereas the subdivision, represented by the letters of the alphabet, A to C, signifies the extent of the tumor. Ladies with higher stage of the cancer are on greater risks than those on the lower stage. Abnormal cells. Abnormal cells are not cancerous cells. They result in what is known as borderline tumor. These forms of growth are however not as dangerous as cancer. They do not spread into deeper parts of epithelial tissues. However, this should not be taken with ease as well, because it could sometimes develop into cancerous growth. The staging process of borderline tumor takes the same form as ovarian cancer staging. This is because both ailments are identical and of similar symptoms. Oftentimes, an abnormal cell may detach from the borderline tumor and settle in the abdomen. It seldom harms the body at this stage. However, physicians are often conscious of its development into cancerous cells. Stage I. According to the FIGO system of classification, the first stage denoted by I signifies that the ovarian cancer is still within the ovaries. However, this stage is further subdivided into 3 stages, namely, Stage A. This stage denotes that the cancerous growth is within 1 ovary. Every normal woman has 2 ovaries. This is the earliest stage of the disease. If discovered, the ovarian cancer can be removed with these. Stage A. This stage denotes that the cancerous growth is already in both ovaries. In this case, it is inside the ovaries, not at the surface. This is still an early stage of ovarian cancer. Stage I. In this stage of ovarian cancer, cancerous cells are not only inside both ovaries, but also at the surface of at least 1 ovary. Too often, cancerous cells are found in fluids inside the abdomen. Thus, the malignant growth has started advancing at this stage. Stage II. This is another level of ovarian cancer staging. This stage of malignancy is more advanced than the previous stage. The cancerous growth has spread beyond the ovaries to the pelvis or hip bone. Too often, cancerous cells are found in the abdominal cavities. The disease symptoms tend to hide at this stage also. Stage II. At this stage, the cancer has spread from the ovaries into the fallopian tubes. Stage II. The malignancy has spread to various parts of the hip bones at this stage. Some tissues of the pelvis become affected. Stage II. The cancerous growth eats deeper into different parts of the hip bones and affects more pelvic tissues. At this stage, abdominal fluids contain some signs of the malignant growth. Stage II. This level of ovarian cancer staging is more advanced than Stage I. The cancerous growth which sprung forth from the ovaries spread far and wide to the pelvis. However, at this stage, the cancerous growth spread farther than the pelvis. All the parts of the body surrounding the pelvis are affected by the malignancy. It spreads even till the abdominal cavity and every parts of the belly. This is an advanced stage of the malignancy and it could be dangerous. It also has 3 sublevels. Stage A. The abdominal lining becomes so affected that cancerous growth could be seen with the aid of a microscope. The growth causes severe damage to the abdomen at this stage. Stage A. At this stage, the malignancy becomes severe. The cancerous growth increases to the size of about 2 centimeters in the abdominal lining. It could be easily noticed and results in difficulty in eating. Stage A. The cancerous growth increases further at this stage. It could be seen to be larger than 2 centimeters at the abdominal lining. This growth can also be seen in some parts of the womb. Stage A. This is a critical stage of ovarian cancer. The cancer has spread to other parts of the body farther than the abdominal cavity, liver and womb. At this stage, cancerous growth can be found inside the liver and lungs and further to different parts of the body.